Today we're at Asfa Plastic Surgery with board-certified plastic surgeon Dr. Saeed Asfa, and we are talking, Dr. Asfa, today about body contouring. First of all, what is body contouring?
Body contouring is the series of procedure that the patient receives after massive weight loss. When they have massive weight loss, they have lots of sagging skin and loose tissue. And body contouring are the procedures that improve the shape of the patient who has lost lots of weight.
And you have a really dramatic example, pictures behind you. Show us what you did for this woman. Obviously, she's lost a lot of weight.
Absolutely. This patient has lost over 75 pounds. This patient has lost with diet and exercise. Interestingly, no surgical procedure before that one. And as we see on this picture, she has lots of overhanging skin, still lots of adipose tissue that needs to be taken care of. And that picture shows after surgery that we have to remove all the excess skin, tightening up the abdominal muscle, and also recreate a new nice shape of the umbilicus area as well.
And so where would the incisions have been in this procedure? And tell us a little bit about the recuperation process from a surgery like this.
Absolutely. The incision for this patient is from hip to hip above the suprapubic area. Very, very tiny incision that you see in this area, but the length of the incision is pretty much from this area completely. Why? Because we have to remove the upper part of the skin, pull them down, and reattach and sew back together. So the incision going to be in lower body area, which is covered when they wear the swimsuit. The recovery of this surgery is about few weeks, and going back to the complete normal exercise, it takes about 5 to 6 weeks to be normal routine life that they used to have.
That's amazing.
It's very interesting that this is one of the most common procedure that we do as a body contouring. After massive weight loss, the abdominal area is the first thing that comes to the patient's mind. They don't want those overhanging skin. Liposuction is part of the procedure as well, because some area of the fat they cannot lose it with either weight loss or exercise. So surgically with liposuction we have to go and remove those excess fat to give the much nicer contour to their body. It's a life-changing procedure. The patient feels much better. I have had patients that after this surgery they got the confidence and they actually went and they got married. That kind of procedure, they gave them much more.
You can definitely see why that would be a confidence builder. Dr. Asfa, another very dramatic result from a woman who has lost a lot of weight. Tell us about this patient.
This patient with gastric bypass surgery lost almost 80 pounds. And as you've seen, she already had the abdomen fixed, she already had her arms fixed, and now she was concerned about the breast area. When you lose the weight, you lose the volume of the breast, as well as you still have sagginess of the skin. The patient underwent 2 surgeries, one of them replacement of the volume with placement of the breast implant, and the second procedure was repositioning of the nipple area and putting the nipple to the anatomical area that it used to be. That's why they have much better shape of the breast and restore the shape of the breast.
And would you do that in one surgery setting, or no?
It could be done in both one surgery or 2 surgeries. To be safe and get much better result, I would rather to do in 2 steps.
And tell us about the recovery period for this surgery.
Recovery for this one is much less and easier compared with the abdominal surgery. The breast implant takes about 2.5 hours, and it's the procedure that recovery is about 1 or 2 weeks. Breast lift is the same thing, so they don't have to be out of the work for a long time. But this is a procedure that I would say the second most common procedure after body contouring after massive weight loss.
Dr. Asfa, show us now the patient who you performed this arm lift on. Tell us what you did here.
Arm lift is another most common surgical procedure after massive weight loss. This is a patient who, as we see in this picture, still has lots of excess skin and also has some area of the fat deposition. She requires to have liposuction and removal of the excess skin. These wings looking arm after surgery looking like that. This is the incision that she has, but of course this is a 1 month after surgery. That's why the incision still look red and the color has not turned to the white color to be less noticeable. Very common procedure that we do, and especially during the summertime when the patient wants to wear short sleeve, if they have lots of excess skin, that's one of the things that bothers them and require to have this kind of surgery.
So now, Dr. Asfa, show us a patient where you've worked on their inner thighs.
This is an example of the patient. As you see, she already had tummy tuck. This is the incision of the tummy tuck. And they always say, Doc, how much skin you can remove from that area? This is a picture that shows you all the area between these lines are the skin that I'm going to remove and make the inner thighs area much more tighter compared with what they had before surgery.
Show us the after picture.
This is the patient that you see.
So you see both before the tummy tuck and the thigh, the work that you did on her thighs, and then after.
That's right. Before surgery, lots of floppy skin. The same this area you can see overhanging skin. After surgery, the incision of the tummy tuck, and also this is the incision of the medial thigh leaf. Big difference. Patient's life completely changed. They can do more exercise, and also they get more confidence to go out and have their normal social life.
Well, the work that you're doing truly does transform people's lives. Thank you so much.
Thank you for having me. Thank you.
Asfa Plastic Surgery.